Welcome, and thank you for viewing this program. This module discusses overactive bladder and prostate cancer treatment. The term overactive bladder, or OAB, describes a group of bothersome bladder symptoms, which include urgency to urinate, frequent urination, and nighttime urination. Leakage episodes or accidents called incontinence related to poor control of bladder urgency may also occur. This is called urinary urgency incontinence. OAB is very common in the general population, affecting nearly 1 in 5 adults. It affects both men and women, and the likelihood of experiencing OAB increases with age. There are many possible causes of overactive bladder. Most people have what is referred to as primary OAB. This means that for some unknown reason, the bladder undergoes changes which cause it to escape the normal control that we have over it. The bladder muscle spasms or contracts, causing a sudden sense of urgency and frequent urination. If the contraction cannot be suppressed in time, leakage or incontinence results. Researchers are continuing to try to understand what causes these changes. In some cases, OAB may develop as a result of some other condition affecting the bladder muscle, the bladder lining, the nervous system, or the pelvis. These are called secondary cases. Many men develop OAB symptoms as a result of an enlarged prostate that causes blockage of the urine flow. This enlargement occurs naturally as men age and is called benign prostatic hyperplasia, or BPH. The enlarged prostate forces the bladder pump muscle to work harder to empty, and as a result it becomes overactive, or unstable. OAB may therefore commonly exist prior to prostate cancer treatment, or it may develop as a result of it. The cause of OAB may be a direct effect on the bladder, or it may arise as a result of a new obstruction of the urine channel, or urethra, from the treatment. Removing an enlarged prostate in some men can actually improve pre-existing OAB symptoms. In others, new OAB symptoms can develop as a result of surgery for various reasons, such as nerve injury or alteration of the bladder wall. It is difficult to know just how common this is, but as many as 1 in 3 men may develop these bladder changes. These may improve with time or stay the same and persist. Up to 5% of men following radical prostatectomy can develop a significant degree of scar tissue where the urine channel is reconnected, called a bladder neck contracture. Other men may develop scar tissue further along the urethra, called a urethral stricture. In these men, OAB symptoms may develop as a result, and these are usually also accompanied by obstructive symptoms such as slow urine flow and difficulty emptying the bladder. Radiation therapy has immediate effects that cause injury and swelling of tissues. Then with time, there can be scarring or fibrosis of the tissues, loss of blood supply to the tissues, and changes to how the tissues are organized. While new techniques allow for the precise delivery of radiation to the prostate, some areas of the urinary tract will be affected. This may have numerous effects that result in OAB, such as direct injury to the bladder and bladder neck tissues, injury to nerves going to the bladder, stiffening of the bladder wall making it less distensible, and stiffening of the prostate. These effects of radiation may be immediate or occur years later. Overall, OAB may be more common and more severe after radiation than surgery, especially if they existed before treatment. Most men will experience symptoms initially during treatment, but symptoms will improve over 3 to 6 months and return to baseline by 12 to 18 months. Some men will develop difficulty emptying their bladder or complete retention of urine requiring a catheter following radiation, especially brachytherapy, due to swelling or stiffening of the prostate from treatment. This type of blockage occurs most often in the initial weeks and months following radiotherapy. A blockage may also occur due to scar tissue formation within the urinary tube called a urethral stricture. This type of blockage is not common but can occur in the months to years following radiotherapy. A small number of men, less than 10%, may require surgery to relieve this blockage, and surgery in this setting may have a higher risk of complications such as incontinence. Diagnosing OAB begins with a visit to your doctor. If your treatment has been recent, this visit will be with the team that delivered it. If not, then you will likely begin with your primary care provider or family doctor, and you may be referred to a specialist as necessary. Your medical and treatment history will be reviewed, and you may be asked to complete a short questionnaire on urinary symptoms. A physical examination may be done to rule out other conditions, and a urine test will be done to rule out blood or infection in the urine. Besides symptom questionnaires, you may also be asked to complete a bladder or voiding diary. In some cases, a PSA blood test will be checked, and/or imaging such as an ultrasound may be done. If not already in the care of a urologist, you may be referred to one for further assessment and treatment. A urologist may choose to perform a simple diagnostic procedure called cystoscopy. A cystoscopy uses a small, flexible scope with a lens and light to view the urethra and bladder. The doctor will first numb the urethra or urine channel inside your penis with an anesthetic jelly, and then insert a small flexible telescope into the urethra. The images from the scope are usually displayed on a video screen. A separate module is available discussing cystoscopy in detail. A urologist will also ask you to urinate into a special device called a uroflowmeter, which records and charts urinary flow patterns, such as the speed of urine flow. The uroflowmeter helps doctors to quickly assess these patterns and diagnose abnormalities in urination, such as obstruction or restriction. A slow urine flow may suggest a blockage. In some cases, a special test called a urodynamic study may be required to formally assess the urinary function. This is a more complex procedure that measures pressures in the bladder as it fills and empties, via small tubes placed in the bladder and rectum. Urodynamic studies help determine the precise cause of various urinary conditions. A separate module is available discussing urodynamic studies in detail. Treatments for overactive bladder can be divided into three broad categories: conservative measures, including behavioral therapy and physical therapy, medications, and surgery. This slide lists some of the non-medical, non-surgical interventions that can help to improve OAB symptoms. The starting point is education, as you are doing now, which leads to a better understanding of normal bladder function and can improve your ability to self-regulate those functions. Without proper education, other behavioral modifications and physical therapy may fall short of their potential. We will review some lifestyle changes that can help, along with bladder training and pelvic muscle training, in the next few slides. As a general rule, fluid restriction is not advisable as a means of dealing with OAB and incontinence. Limiting fluids will make the urine more concentrated, which can cause bladder irritation and actually worsen urinary urgency. The exact amount of fluid required to drink will vary in each person, but you will know that you are well hydrated if there is little color to the urine. Avoid or limit caffeinated beverages such as coffee, as well as alcohol, as these can worsen OAB symptoms. Selective fluid restriction is appropriate in certain situations as indicated by your physician. For example, someone who is taking in excessive fluids should be encouraged to cut back, and someone who suffers mostly from nighttime urination might be advised to cut back on fluids in the evening. If you are bothered mostly by nighttime urination, consider these measures. Try reducing evening fluids, completely reducing fluid intake after 7 p.m. It is important, of course, to still keep your fluid intake up during the rest of the day. Be sure to empty your bladder completely before going to bed. If you snore or stop breathing at night, talk to your doctor to rule out a condition called sleep apnea that is a common cause of excessive nighttime urination. If swelling of the ankles or feet occurs during the day, nighttime urination may result. This happens because, when you lie down at night, the fluid is no longer held down in your extremities by gravity and is allowed to get back into the circulation. The body then has to clear out all this excess fluid and starts making more urine. To help manage this problem, if it is comfortable, try spending some time during the day with your head down and feet up on pillows above the level of your heart. This will help get rid of more fluid in the daytime when it is more convenient for you. Beyond this, you should see your physician, as medications or adjustments to your medications may be required. The byproducts of smoking are considered an irritant to the bladder lining and may increase OAB symptoms. Furthermore, smoking is an important cause of bladder cancer. Regulating bowel habits and avoiding constipation through increased fluid and fiber intake may also improve urinary symptoms. Regular exercise can improve blood flow to the pelvic structures, which can in turn improve their overall health. The goal of bladder training is to gain a greater control over urgency, to accept larger amounts of urine, and to reduce urge-related accidents. To be successful with this therapy requires significant motivation and is best done with the assistance of a dedicated therapist and occasional bladder diaries to provide feedback. Initially, you are asked to adopt a regular schedule of urination. For example, set a goal of only urinating every hour or two by the clock. When an urge to urinate does come on, try to suppress this using the techniques on the next slide. Gradually, you should be able to lengthen the interval between urinations. Try these techniques to suppress urinary urges. Stop what you are doing and stay still. Squeeze the pelvic floor 5 or 6 times quickly, 2 to 3 seconds each contraction. Keep the rest of the body relaxed. Focus on something else, such as counting backwards. Finally, as the urge passes, try to walk to the bathroom at a normal, relaxed pace. Pelvic floor muscle training works to strengthen the muscles of the pelvic floor, which support the structures in the pelvis, such as the bladder. Through these techniques, men can better learn to contract the muscles around the urine channel, which in turn allows him to fight off an urge to void when it comes on, and avoid or limit any leakage of urine. Ultimately, a person can gain the ability to unconsciously contract these muscles. Men with another type of urine leakage called stress incontinence can also benefit from pelvic floor muscle training. This subject is discussed in detail in a separate module. This slide demonstrates the pelvic floor muscles in a man following surgery and radiation for prostate cancer. When simple measures fail and symptoms are bothersome enough, medications may be required. There are many drugs now available which are very effective in treating the symptoms of OAB. The majority of these drugs work by relaxing the bladder muscle, and ideally should be combined with ongoing efforts at the conservative measures we have just described. The medications used to treat OAB do so by relaxing the muscle, called the detrusor muscle, that makes up most of the wall of the bladder. These drugs have been proven to be very effective and lead to less frequent urination, less urgency, and fewer leakage episodes. There are 2 classes of drugs available for treating OAB, called anticholinergics and beta-3 agonists. This slide lists in alphabetical order the names of the available anticholinergic medications. All of these drugs are generally equally effective in treating OAB. Newer anticholinergic medications are fairly well tolerated. However, some side effects are still common, and occasionally these may limit their use. The most common side effects include dry mouth, dry eyes, and constipation. If you get dry mouth, try using a sugar-free lozenge or gum, or speak to your pharmacist about other ways to manage it. Less common side effects include blurry vision, rapid heartbeat or tachycardia, flushing of the skin, difficulties emptying your bladder, and effects on the brain such as drowsiness, confusion, or impaired memory. With topical agents, some patients may experience skin irritation at the site of application. There are a few special circumstances where caution is required before taking these medications. These include a certain uncommon type of glaucoma or elevated pressure behind the eyes, difficulties emptying the bladder, and poor motility of the bowels, which may occur after some surgeries. Caution may need to be exercised with some of these drugs in the elderly and confused patients. Finally, patients on certain medications, especially those to help control heart rhythm, may not be candidates for some of these medications. Speak with your doctor or pharmacist if you have any concerns about taking these medications. Beta-3 agonists work differently than anticholinergics, by promoting relaxation of the bladder muscle rather than by blocking abnormal contractions as anticholinergics do. To date, the only approved beta-3 agonist is called mirabegron or Myrbetriq. Generally, the drug is well tolerated, but occasional patients may have an allergy or sensitivity to it. Those with severe liver or kidney failure, along with those with severe uncontrolled high blood pressure, should not take the drug. A small number of medications may interact with these drugs, and you should review your list with your doctor. Possible side effects of this type of drug include increased blood pressure, common cold symptoms, or nasopharyngitis, urinary tract infection, headache, constipation, or difficulty voiding. Many patients are curious to know how long they might require these medications for OAB. Unfortunately, it is impossible to predict what will happen to OAB symptoms over time in any individual. Most patients will require lifelong treatment. However, some may stabilize their symptoms over time. Depending on your situation, your doctor may allow you to try cutting back or stopping the medication every 6 or 12 months or so and reassessing the symptoms. Voiding diaries are helpful to recognize any changes. When required, there does not appear to be any problem with taking the medication long term. A few pointers are worth noting in order to optimize the success of these overactive bladder medications. If your doctor offers you a sample, try these first. This is just to be sure that you can tolerate the drug safely before filling your prescription. Secondly, begin on a weekend or other day off just in case you do have any bothersome side effects. Take the medication regularly at the same time of day. As it may take some time to realize an effect of the medication, take it regularly for about 4 weeks or so before drawing any conclusions. Combine the medications with behavioral treatments, such as bladder retraining, as previously described. And finally, reassess your symptoms occasionally through the use of voiding diaries. There are times when patients cannot find relief from conservative measures and medications alone. Initially, if you are not experiencing relief of symptoms, your doctor may try increasing the dose of the medication you are taking or try switching you to a different one. Failing this, some patients may be candidates for injections of a drug called Botox, or onabotulinum toxin A, into the bladder. This therapy is being used more and more for this type of bladder problem. A separate module discusses this further. Besides Botox, many patients have found relief through the placement of a so-called bladder pacemaker, or nerve stimulation device, into the nerves of the lower spine, pelvis, or groin. Finally, as a last resort, some rare patients may require surgical enlargement of the bladder, or even more rarely, removal of the bladder in the most severe cases. In summary, overactive bladder is a condition of frequent and urgent urination, nighttime urination, and sometimes urine leakage that can have a negative impact on a person's quality of life. OAB is a common condition and often is present prior to prostate cancer treatment. However, OAB can also develop after any prostate cancer treatment. Successful treatments for overactive bladder do exist. These begin with certain lifestyle changes a person can make, along with behavioral changes and physical therapies. When this is not enough, very effective medications can be prescribed, and failing both of these, surgical treatments are also available. Your doctor can help guide you along your way to overcoming the bothersome symptoms of overactive bladder. Thank you for viewing this educational program.